Identifying patterns in disease relationships enables personalized care. For a long time, diseases have been treated by name. One drug for a cold, another for inflammation. In most cases, this works. It is fast, safe, and reproducible. But sometimes that most cases does not include our body. Standardization is not wrong, but it leaves spaces that standards alone cannot reach. Even with the same cold medicine, one person recovers quickly, another feels stomach discomfort, and another develops a skin reaction. The medicine is not the problem. Each body responds differently. Ibuprofen is no exception. It is an effective anti-inflammatory and fever reducer, but it requires caution in infants. It can also be dangerous for those with certain allergies. The doctor asks, were there side effects? Any allergies? These are important questions. Yet, questions alone cannot explain everything. When sleep, stress, comorbidities, other medications, and daily habits overlap, the response becomes far more complex. The direction of medicine is shifting from a treatment that works for most to a treatment that fits each person. This is called precision medicine, or personalized medicine. Genes are often cited as the starting point. Through gene panel analysis, it becomes possible to see which drugs a person is sensitive to, where disease risk may be higher, and which mutations are linked to specific cancers. This includes the likelihood of recurrence within a family. Rather than viewing a disease under a single name, the focus shifts to reading it as a network of conditions. Genes are a condition. Lifestyle is a condition. Immune response is a condition. Drug response is the result these conditions create together. Reading this network requires data. When the sample is small, chance appears large. As samples accumulate and scale grows, signal and noise begin to separate. The cost of gene sequencing is falling, but if personalized care is not to remain a choice for a few, access must be addressed as well. Yet, data alone does not produce answers. Relationships must be read accurately and verified. Precision medicine is not completed by better equipment alone. Its foundation is the accuracy of interpretation. Technology is already moving in many directions. Doctors now extract a patient's immune cells, T cells, and redesign them to recognize cancer cells. Efforts continue to regenerate damaged tissue using stem cells. For some, this is technological progress. For others, it may mean more time to live. There are also attempts to tailor the drug itself. Using 3D printing, dosage and composition are designed for each patient. Body weight differs. Metabolic rate differs. Even with the same medication, the effect is not the same. However, most pills are produced in standard doses. Children split them. Some adults share the doses. As prescriptions increase, simply managing medication becomes a burden. With printing technology, required drugs can be placed in a single pill at personalized doses. Conventional combination drugs have typically targeted causally related conditions together. Printing technology broadens the boundaries of combination. It opens the possibility of designing a single pill that treats diseases once thought unrelated. Yet, the more precise the treatment becomes, the more data it requires. If that data is leaked, the harm is serious. For this reason, medical institutions encrypt and store data securely, restrict access, and establish institutional safeguards alongside it. Knowing more precisely is not always comfortable. The clearer it becomes, the more there is to choose. The more choices there are, the more responsibility follows. If we are moving from an era that named diseases to one that reads patterns of relationships, how far does that pattern serve as a map for treatment? And from where does it become a record that explains who we are?